Have you ever looked down and discovered one of your toenails has turned black? Well, you don't need to panic, but don't ignore it either. While often harmless, sometimes a black toenail can signal a more serious condition that needs more immediate attention. Today I'll be talking about what can cause black toenails, how they're treated, and what you can do to prevent them from happening. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook called Guide to Eliminating Fungal Toenails, one of the many common causes of black toenails. You can download it in the description below. If you find this information helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. First, let me walk you through what a black toenail might be telling you. Many black toenails are the result of simple trauma. For example, if you're a runner, hiker, or a rock climber and you wear shoes or boots that are too tight or don't fit properly, it can cause this black toenail. If you drop a heavy object like a tire iron on your toe or a frozen turkey, you can certainly get a black toenail. Finally, if you kick a hard object, and this is the most common one, like a furniture, especially in the middle of the night, if you don't expect to ram the toe in there, you can get a black toenail. These injuries cause bleeding under the nail, called a subungual hematoma, or a little blood clot. It won't travel anywhere, but this will create the characteristic black appearance. While they may look ugly, black toenails from trauma will eventually grow out, though you may lose the nail. However, if it's painful, you may need to have a podiatrist drain blood that may have accumulated under the nail. It's a pretty innocuous procedure, and once done, will return to your normal activities quickly. While the black color will eventually disappear, you may instead be left with a misshapen, or called a dystrophic toenail. Once this occurs, there's little you can do to correct it in of itself. Black toenails can also point to a fungal infection called onychomycosis. Because our feet spend most of the year in socks and shoes, it creates a perfect warm, damp, dark environment for fungus to thrive. When the nail lifts slightly due to pressure, fungus can enter and set up shop underneath the nail. You're more likely to develop fungal nails if you're an active person, like a runner, hiker, or climber, and your shoes cause repetitive stress on the nail bed. If you wear cotton socks that remain moist all the time, if you go barefoot in pools and locker rooms, yoga studios, share nail tools, or go to a nail salon that isn't cleaning their equipment properly, you may develop fungus of the nails. While most people want to get their fungal nails treated, not everyone feels the need to do so for cosmetic reasons alone. There are several other reasons why it's more important to seek treatment than just cosmetics. Fungal toenails can spread to more vulnerable family members. Toenails can become thicker, hard to cut, and painful. A fungal toenail infection can spread to other parts of the body. It can triple a diabetic's risk for developing ulcers, that is, wounds, which can lead to prolonged infection and even amputation. Finally, the longer you wait to get it treated, the more difficult it is to treat it and eliminate it. Fungal nails can be challenging to treat, especially if they've been present for a while or the nail is thickened. Fortunately, over the years, we've developed a comprehensive treatment plan combining the most effective methods for eliminating toenail fungus, with 80 to 90% of our patients showing satisfaction with their care and resolution of fungus. We use the lunula laser combined with topical medication for the nails and skin, and a shoe spray to eliminate fungus in your shoes. We have also an advanced aftercare program now to help prevent return of fungus. To learn more about this program, check out the link in the description below. Prevention, however, is always better than treatment. Here's how to reduce your risk for a black toenail, a misshapen toenail, and toenail fungus. Always wear moisture-wicking socks instead of cotton. I've put a link to the best socks for runners and hikers in the description below. Alternate between different pairs of shoes daily to allow them to dry out. Make sure your shoes or boots fit properly. Even adult feet can grow longer as we age. If your toenails are hitting the inside top of your shoe, this creates an entry point for fungus. Wear flip-flops around pools and in locker rooms. Bring your own yoga mat to your class. Don't share towels or nail tools. Avoid going to nail salons that don't properly clean their equipment. Check out the link in the description below. If you're a runner, be sure to check out my video above on runner's toe for more specific information about preventing black toenail. If you're a hiker, check out another video above on how to prevent a black toenail when hiking. Now for the most important reason to never ignore a black toenail. This is called melanoma. It's a dangerous form of skin cancer that develops from a mole that becomes malignant and can appear under the toenail and tends to grow very slowly. Melanoma is one of the most common cancers of the feet, though it is not very frequent that it occurs overall. And because we don't examine our feet as often as our face, melanoma on the feet typically has a higher death rate as it's discovered often too late. Some signs of melanoma on the nail are a new brown or black band that's a streak from the cuticle out to the end, dark color spilling over to the skin next to the nail, signs of infections such as dryness, pus, and pain, a bruise, splitting, or bleeding of the nail without any history of trauma, a bruise under the nail that doesn't go away. Although some dark bands can be non-cancerous and caused by bacterial or fungal infection, it's important to get it checked out as soon as possible. Schedule an appointment with a podiatrist for a proper diagnosis. In conclusion, while most black toenails are harmless, if you have a fungal nail infection, it's important to get it treated to prevent complications later on. And if it turns out to be melanoma, it's essential to get it treated immediately to save your life.